Hi guys, I'm Jackie. I'm part of the Frenzies team here at Momseze. I'm a registered nurse and a board certified lactation consultant, and today I want to talk about a very hot topic, sex. That's right, sex. Sex after baby and sex when you're breastfeeding. So after you have your baby, probably the last thing on your mind, honestly, is going to be sex. That is okay. It's okay if you're not interested. It's okay if you're not in the mood. It's okay if it doesn't even cross your mind, honestly, for the first several weeks and even a few months after your baby's born. There's several factors for this. Of course, hormonal changes in your body can be a big deal. Some women feel very self-aware and maybe not so confident in all the changes that have happened in their bodies during pregnancy. And if that's happening for you, I would encourage you to get in front of the mirror and tell yourself that you are beautiful and wonderful and amazing because, girl, you just made a baby and it came out of you. That's a big deal. That makes you a superhero. So definitely no reason to be ashamed there. But also exhaustion. I mean, being a mother it's a full-time gig. There's never really a break. And especially with a newborn in the house, you're just going to have to deal with a whole new level of exhaustion than you've probably dealt with before. And it's okay if it takes you a while to adjust to that. That's very normal. And I promise you, you will get into a groove, life will settle into the new normal, and things will be okay. You may feel like, oh my gosh, what have we done? And are we ever going to have time for each other? Am I ever going to desire to be sexual again? And I just want to let you know, those are all normal feelings. So there are a few things to consider. If you have had a very traumatic delivery, things can be different in the healing process for you. If you have stitches, sutures from an episiotomy or from a C-section, obviously those are very delicate areas and they're going to take some dedicated healing time. So you need to listen to your doctor, whoever delivered your baby, whoever's doing your aftercare, as far as when you can have sex again. In many cases, that's 6 weeks, but not always. So definitely listen to whoever is doing your postpartum care, their healthcare professional in that regard. And just because they tell you you're released and you can have sex, that doesn't mean that you necessarily should have sex. If you are still experiencing a lot of discomfort and pain and you're just not even sure if you want to try because of that, definitely talk it over with your doctor. Talk it over with your healthcare professional because that's all something that is good information for them to advise on your healing. But also, sex is something that's so personal and so intimate that I find it very important that after you've given birth, you don't feel rushed or feel scared about it. It's okay to be a little bit nervous and to wonder, what's changed? How's it going to feel different? Is it going to hurt? Those are all normal feelings. But I would never encourage you to have sex if you're feeling pressured or truly scared. Give yourself time to feel ready. And when you feel ready and your healing process has come to the point where you've been released, take it really slow. Start with some touching, some ways of getting in the mood and having physical contact that don't immediately jump to intercourse, because that's the part that's going to probably worry you and be the most concerning to you at first. So it's absolutely okay. Talk to your partner. Make sure that your partner knows why you're concerned or why maybe you're a little bit timid and why you need to go slow. One of the best tips I can give you is to use lubricant.
Sue?
I'm sorry, I didn't know this was going to be happening today. I am ecstatic to be a part of this.
If you've never used lubricant before, after baby, you may find that it's necessary, at least for a little while. And if you're breastfeeding, you may find that it's necessary until you stop breastfeeding. That all has to do with hormones, but that doesn't mean that you can't have great sex after baby and while you're nursing. Well, not while you're nursing, but while you're breastfeeding. You know where I'm going with this. So make sure that you explore the lubricant and talk to your partner about using it if you're experiencing some vaginal dryness. It's going to make things a lot more comfortable. It's going to make things more enjoyable, and I promise you it's something you're going to want to consider at least after having baby, and especially if you're breastfeeding. Something else that is important to talk about if you're breastfeeding, maybe consider how you're going to feel about your breasts being touched. It may be something that is completely different for you when you're breastfeeding. There are certainly lots of women out there who don't have any problem having their breasts touched and handled the way that they did before breastfeeding. But then there are also lots of moms who don't want their breasts touched, or maybe they are fine with their breasts being touched but not their nipples. Make sure that you're having those conversations and communicating with your partner about that, and it's okay even in the process, even during sex, to say, you know what, I'd feel more comfortable with my shirt on, or I'd feel more comfortable with my bra on. I'd feel more comfortable if you only touched me this way. It's absolutely okay to make those things known to your partner, because this is a huge change going on with your body. And if you're breastfeeding, there's probably going to be a part of you that feels like those breasts no longer just belong to you. They're kind of babies now too. You'll hear moms say all the time, well, I want to feel like my body is my own again after pregnancy. And sometimes moms can feel that way with breastfeeding too. They feel a little bit like their body's not only their own, since they're also responsible for making food and delivering that food to baby. So
I gotta feed Stella.
Okay.
She awake? More milk than woman. Oof.
Okay.
those are things to really think about and kind of prepare yourself for, so that it doesn't take you by surprise when you're actually in the process. Something else that I would consider is, talked about lubricant, we've talked about being touched, but you may want to talk to your partner about how they feel with touching you, especially with your partner could be worried about hurting you, touching your breasts in a wrong way. So communication really is key throughout all of this, kind of the common thread throughout all of this, talking to your partner about how you feel about it, how your partner feels about it, and then figuring things out together.
Okay. Woo!
We are not high-fiving.
Something else to consider is birth control. Definitely be having a conversation with your healthcare provider if you don't want to become pregnant again, because just because you are breastfeeding does not mean that you cannot become pregnant again. In fact, there is a possibility of becoming pregnant again, even if your cycle hasn't returned, if your period hasn't returned. It's not unheard of. So just keep that in mind, and definitely talk to your healthcare professional. If you're concerned about how birth control is affecting lactation or could affect lactation, definitely contact a lactation consultant. We can advise on, what may be the first choices for birth control. Something that women don't always know that I think it's important to point out if you're breastfeeding and starting to have sex again is that you can experience leaking during sex, and a lot of times when women reach climax or orgasm, they can even have milk that lets down. It can spray or leak a lot more than at other times during sex. And that's because some of the same hormones are involved when you have an orgasm that also create that letdown effect. So I always want to point that out to new moms, because if you've not experienced that before, it can really take you by surprise, and of course take your partner by surprise. But if you know about it, you're aware that it could happen, maybe that would take away some of the shock value when that happens. And just so that you know too that it's very normal. Sometimes I think things like that can happen and we don't talk about them, and so then you don't know if it's normal or not. And I just want to let you know that can happen, and not to let it take you by surprise or deter you. Just, you can be prepared. If it bothers you, you can wear your bra with breast pads or have a towel ready, and just communicate with your partner about how you both feel about it. I know this topic is sensitive. I know a lot of people don't like to openly discuss sex, and others are completely comfortable with it. But as a healthcare professional and a lactation consultant, and as a mom, as a woman, I feel like it's really important for other moms and other women to to know these things after they've had a baby, and especially if they're breastfeeding. There's a lot of things to think about when it comes to resuming sex with your partner. And so if you have questions, always reach out. Here at Momseze, we can answer those questions. We can help you walk through that. And just know that you are not alone. We've been there before too. Thank you.